Hello, my name is Brittany Goody, and this is my presentation of the ethics case study for APN 602. Let me share. There we go. So I will be discussing the Code of Ethics for the Nutrition and Dietetics Profession, and I will use a case study to see how the Code of Ethics could look in practice. Here is what will be discussed in this presentation. First, I will introduce the principles of the Code of Ethics for the dietitian and nutrition and dietetic profession. Then I will recap the case study video and how the Code of Ethics applies to the case study. I will wrap up the discussion with an example of how an RDN could respond in this situation. The Code of Ethics for the nutrition and dietetic profession is made of 4 principles: non-maleficence, autonomy, beneficence, and justice. 32 standards fall under these 4 principles. I won't be going through each standard individually, but they are all listed here and linked to in the reference page. The first principle is competence and professional development in practice. The standards that fall under this principle focus on providing quality care within a practitioner's scope of expertise that is evidence-based and considers the patient's values. Part of providing quality care is knowing the limits of your knowledge and collaborating with others to fill in knowledge gaps. A nutrition and dietetics practitioner should always act in a caring and respectful manner. The second principle of the Code of Ethics is integrity in personal and organizational behaviors and practices. The standards under this principle focus on respecting other people and organizations, as well as others' property. Practitioners should be upfront and truthful in business dealings, including recognizing others' work and obeying the governing laws and regulations. A patient's decision should be respected and confidentiality maintained. Inappropriate behavior towards a patient or other professional should be reported. The third principle of the Code of Ethics is professionalism. The focus of these standards are on helping others succeed in their education and professions by collaboration, communication, and respect. Respect for others should be shown through maintaining professional boundaries and performing objective evaluations. The fourth principle in the Code of Ethics is social responsibility for local, regional, national, and global nutrition and well-being. These standards under this principle support equality, human rights, and the well-being of others. These opportunities also contribute to gaining the public's trust of the nutrition and dietetics profession. Now I will review the case study linked in the bottom of this page and use the Code of Ethics to help me formulate an ethical response. The case study video starts with the patient, Mrs. Sweet, stating she wants to have a feeding tube that is placed removed. Her daughter acknowledges her mother's frustration but disagrees. She believes the tube is necessary for her mother to get proper food and fluid intake. The daughter worries her mother will forget to eat or drink due to her dementia. Mrs. Sweet does not have an advance directive, and no other medical history is available other than her daughter's statement that Mrs. Sweet has dementia. The first question to address here is whether this is an ethical concern or a business dispute. The situation is evaluating whether to follow the patient's directive or to follow the daughter's wishes for the patient. The daughter's concern is valid. Removing the feeding tube may put Mrs. Sweet at a higher risk for dehydration and malnutrition. This is an ethical question, not a business dispute. Do you follow the patient's wishes, putting her at a greater nutritional risk, or do you prioritize her health against her wishes? Dementia further complicates this situation since the patient may not be making a logical decision. So how does following the Code of Ethics help direct the RDN's care of Mrs. Sweet? If we look back over the Code of Ethics, the first principle, non-maleficence, reminds us that whatever choice is made, it's important to act in a caring and respectful manner towards both Mrs. Sweet and her daughter, regardless of the personal opinions on what should be done. The RDN's scientific knowledge is not a central point in this situation, though it is important for implementing whatever choice is made. This second principle plays a primary role in this ethics case. Personal autonomy should always be respected. A patient has a right to make decisions about their care. If Mrs. Sweet decides she wants the feeding tube removed, even if it results in harmful consequences, healthcare providers must comply. If Mrs. Sweet did have severe dementia and her daughter and other healthcare providers did not think she was capable of making these decisions for herself, the daughter would need to go through proper channels to receive a medical power of attorney. Since the daughter does not have that, Mrs. Sweet's decisions are all that counts. In this situation, it's important to clearly explain the options Mrs. Sweet has and communicate well with the care providers to improve health outcomes. It is the RDN's responsibility to participate in the conversation between the client and her daughter to clearly inform and guide them in their decision-making. Since this last principle focuses on social justice, it doesn't explicitly apply to this case. Using these standards, a response can be formulated to the situation. One assumption being made is that the patient allows the daughter to know her private medical information. First, I would initiate a conversation between Mrs. Sweet and her daughter about each of their concerns. Then I would inform them what the health consequences to each path are, as well as possible accommodations that could be made to improve the results of each decision. Last, I would ask Mrs. Sweet if she still wants to have the feeding tube removed, and if she did, I would politely inform her daughter that Mrs. Sweet desires will be respected and that we can make a plan with the healthcare providers to ensure Mrs. Sweet gets proper nutrition. I will role play what this might look like in a conversation. Mrs. Sweet, since you know the risks of having a feeding tube removed and still want it taken out, I will talk to your healthcare provider about getting that removed for you. To the daughter, I would say, I know you have concerns about that your mother will not remember to eat once the feeding tube is removed. But the patient's decisions about her health care must be respected. Let's talk about ways the healthcare team can ensure Mrs. Sweet will get adequate nutrition without the feeding tube. The Code of Ethics provides a standard of practice for nutrition and dietetic practitioners. It can be referenced when a practitioner is uncertain how they should proceed. The code helps to protect the people the practitioner works with and promote a high level of professionalism. Practitioners with membership in the Academy of Nutrition and Dietetics all agree to follow the Code of Ethics. Thank you for watching my presentation.